Invisalign is easier or harder than the expander, or like kind of the same?
Easier because I can take it out and like if stuff gets like stuck in it, I just take it out and like use my finger. Like so once I was in school and I had my Invisalign case in my backpack because I had forgot to put it back in after snap. And when I looked in my backpack, I couldn't find the case and I was like, oh my God.
The yellow zone is the maxilla. So this big yellow bone is connecting to zygomas, to frontal bone, to some bones inside the orbit. And all of those connections, all those sutures that we see here, they exist in our skulls. They haven't fully fused and they are being disconnected during the course of treatment.
Just like when we talk about tongue tie releases, it's not just one thing that you're doing to change the structures. It's a process because our bodies are slowly changing and adapting always to the structures. It makes sense that it takes a while to do that.
Okay, so both girls just had their fixed expanders out, and that was really exciting, right, with Dr. Koval. Now you guys so you've been doing Invisalign on the bottom, you had a fixed expander on top, and now you're waiting to get your fixed expanders for the top, which will be in next week. So about, actually 7 days, I think, until they're in, because we're going next Wednesday. So you guys both have your bottom aligners. We're getting the top, all exciting things. Now we thought it would be really fun to share what this process has kind of looked like from expanders to clear aligners. And then I'll give you an update on my MARPE journey. So let's jump in. Lily, tell everybody, how old are you?
I'm 10 years.
You're 10. And Mia, how about you?
7.
7. Okay. So I'm going to ask you, Lily, first. What did it feel like when you first got your expander put in? Do you remember?
It felt sore and tight because it's really skinny, the part that fits between your teeth, but it feels like a lot, even though it's
A piece of metal.
And once you get it out, it feels really weird because you're not used to it. And
what part felt weird when you got it out?
When you touch the top of your palate, it tickled, and it was only for not a few minutes.
A few days, actually.
Yeah, a few days.
You guys were complaining that it felt because it was more sensitive for your tongue to touch the roof of your mouth because it really hadn't been up there, right?
There was also some cuts, so it stung when we ate certain foods. Mm-hmm. We had brisket left over from
Rosh Hashanah.
Yeah, we had brisket left over from Rosh Hashanah, and it stung. Also things with acid, strawberries and oranges.
Stuff.
Yeah, because we have.
Yeah, because your palate just gets a little bit scraped maybe as it's coming out, but it's also in certain places was used to having the expander sit up against the palate. And so I think in those areas where the expander came out, it wasn't that it was cut, it was just that the skin was really sensitive because it hadn't had anything but that expander touch it for 6 months, right? Yeah. So Mia, how about you? Do you remember what it felt like when you first got your expander put in?
It hurt and it felt...
It hurt? It was really painful, or it was sore, or what? What does that mean?
It felt like there was something in my mouth that I couldn't take out. So it felt like there was no room in my mouth.
And then how about when you got it taken out?
It felt so nice and felt like someone took the top of my mouth out.
Okay, so Lily, was it really weird to talk when you first got it, and then think about when you got it out? Did that make it easier? Was it harder to talk again? What do you think?
Well, at first, it was a little bit difficult to talk, but when I talked, I got used to it so quickly. Only the other people around me noticed the difference in how I talked.
What about when you got it taken out?
I actually noticed the difference when it got taken out.
Meaning it was harder to talk? Easier? Easier. Okay. Mia, how about you?
It didn't really make a difference about some different things I was able to
certain words were still easy to say. Were there any words or sounds that you feel like were harder to say, even if you can't remember what they were?
Like it felt I could say things that I couldn't say.
Oh, when it came out?
Yeah.
Got it. So it was harder to say it when the appliance was in. I agree with that. You know why? Because there's not as much room for your tongue. So I find my tongue hitting against my appliance trying to say something, and sometimes it stops it, and then it sounds a little funny to me. What's up, Will?
I also want
to... Do any funny stories?
You can't suction your tongue.
Right, because it's blocking your tongue from suctioning to your palate when you have it in there, right?
Or doing, what are these called?
The tongue clicks?
Yeah, you couldn't do tongue clicks or suctioning.
But now you can. So here's the crazy part. Okay, so part of my update is I got the arms taken off. So the part that was actually physically touching my teeth was cut off, and the metal going around my teeth was taken out. And there's only now in the center of my palate holding the expansion while the cell regrowth happens down the center of my palate. So it felt really weird when that first happened because, again, there was some sensitivity. But after that went away, what I noticed was I can now suction my tongue to my palate. So there's nothing blocking, and I can click. There's nothing blocking my tongue from doing that. It's harder. It's not as easy as if the appliance wasn't up there, but I'm able to do it because there's no longer anything. There's space between the appliance and my teeth around the edge of my palate, which is pretty cool. Okay. Let me think about what else I can ask you guys. So what is your most favorite part of not having the appliance anymore?
We don't have to pick food out. Especially sometimes when some stuff bacon, sometimes it hurts when it gets stuck. Oh yeah, sometimes things hurt.
Mia, do you have a favorite thing? Number one, what's your favorite thing?
Eating gummies and popcorn.
I was waiting for that answer. Was there something else you wanted to say about the best thing about not having it anymore?
It feels like my tongue has so much more room to move around.
Do you miss it?
Not at all.
So for anyone listening who's not familiar, expanders help create more room in the upper jaw. It's not just to move your teeth, but to actually create room for your teeth, but also for the tongue and to open your airway. And so they can make a big difference in how you breathe, how you sleep, your facial development, especially when you start them young in kids. You're not a lost cause if you're an adult like me, but all right. So Lily, I have a question. You've had your Invisalign. What?
Expansion. I had, my nose wasn't stuffy, but I had
Congestion?
I wasn't congested. I feel like after getting the appliance out, when I got a cold, I wasn't congested. It wasn't hard to blow my nose. When I blew my nose, something always came out, and it wasn't that before I had expansion, because my nose was always stuffed up when I got colds.
So it's making things flow through your airway more. Okay, so I want to ask about Invisalign a little bit, and this is going to be a super short episode, so I'm only going to ask you one answer each, no long stories, okay? We're going to do rapid fire. Do you know what that means? I ask a question, you answer quick, move to the next one. Okay, so for Lily, you've had your Invisalign for a little while now. How does it feel compared to your expander? I know you have only had the bottom one, but you don't have.
I like it better because I'm able to take it out. And I've also learned how to take it out with my tongue. My tongue is pretty strong because I used to do Maya.
Okay, so was it tricky to learn how to put it in and take it out? Or was it pretty easy?
Invisalign?
Yeah.
No, you just pop it on and pop.
All right, do you notice any pressure or tightness when you switch to a new set every week you switch to a new one?
It actually depends. Because how much I was wearing my Invisalign before, which I'm pretty good about. But sometimes I miss a day, which is very rare. Like if we're really.
Sometimes you don't miss a whole day. Sometimes you'll take it out and leave it on the counter, and then get dinner. I'm like, Lily, you don't have your appliance in, and then you put it back in, right? Oh, sorry, your Invisalign. Okay, and how is talking and eating with the Invisalign specifically?
Oh, I don't really. I take it out when I.
And technically, Dr. Koval said you can eat with them in.
Yeah.
So kids who are in school, parents are worried, you can actually leave the Invisalign expanders in your mouth. And they are expansion appliances that they're using. It's not just like for straight teeth. It's actually to, basically put the teeth where we want them. But you can technically eat with them in, but both of you take it out at school, right? Yeah. Okay, Mia, your turn. You have your bottom Invisalign. It's been in since the beginning. How do you feel that's going for you? Does that bother you? Do you like it? What are your thoughts?
It's fine, because when I switch to the next one, it's just a little tight, because it's just a little... I think
it's good. It's shifting it a little bit more, right? Little by little, it keeps shifting things every week. Yeah.
And at first, I didn't take it out to eat, and then it would get all yellow.
Okay, yeah. Are you excited to get your top next week? You are. Okay. Do you think that the Invisalign is easier or harder than the expander, or the same?
Easier, because I can take it out, and if stuff gets stuck in it, I just take it out and use my finger and
clean it out, right? Yeah. What's the funniest thing about wearing them? All right. So since everyone's asking about an update on my appliance, I'm going to give you a super, super quick update before we wrap this up. So yes, I'm still wearing my MARPE, which stands for Mini Screw Assisted Rapid Palatal Expander. Some people say micro implant, but usually I see Mini Screw Assisted. And basically, I have 6 screws that are screwed into the appliance, into my palate. The arms, as I mentioned, that were attached to my teeth have been removed. So it's much more comfortable now. Things don't get stuck as easily. And if they do, they're much easier to get unstuck from the appliance. But that center part is still up there with the 6 screws in place. And so that's helping to stabilize everything as the bone in my palate the regrowth happens, the cells grow and everything sets. And so I have to wait for that midline suture to fully fuse before, we'll have those lasting airway and skeletal changes. And then, they can be taken out. I'm also in, as I mentioned, the memory clear aligners on top and on bottom. So I'm 1 week and a couple days into those. I have worn a lower clear aligner for as long as I've had my in, but when the arms came off, they redid all of the imaging and I Tero scan and then created an upper aligner. And so now I'm going week to week. And so I'm on week 2 of my upper and lower aligners that come together in a little set, since we're doing upper and lower now. And so I'm way further in week wise for as far as the lower expander goes, but with the aligners, but for all intents and purposes, we'll say week 2 that I've had now upper and lower. And so what happens is when I actually put these in my mouth, it's different than Invisalign. I have to run them under warm water so they soften. And then I put them in my mouth over my teeth and it then shapes around my teeth and the clear aligner has this memory built into it. I don't understand all the science and tech and everything, but they're really cool. They reshape and then that's what guides the expansion, which is really cool. So anyways, they remember where they're supposed to be, where they're supposed to move your teeth. And so it's slowly closing my gap. I actually don't have on the top right now, but when I have it in, my gap actually looks much, much smaller just because of the plastic. So that's pretty wild. And so I can, it's slowly closing the gap between my 2 front teeth. And it's also going to help line up my bite properly, which is the big part. And we have probably another 1.5 years of this, to be honest with you, but I can already feel a difference. I'm breathing better. I'm sleeping better. It's wild. I don't have any pain in my TMJ. My lower mandible is not deviating. Get used to when I speak. It also, when I open it wide, only deviates slightly instead of majorly it was before. It was much more significant. And so it's really wild to see this change as an adult, which is really exciting. But so the girls and I are basically going through our airway journeys together, which is super fun and super cool. And so, if you guys were let's wrap this up. If we were going to give any tips to anybody, do you have any tips or advice that you would give to another kid who is about to get an expander? Lily?
If you use a water pick to get your food out,
highly recommend.
Level 2 or level 3 is probably best level to put it on because level 1 does barely anything. But some food is loose. But maybe start with level 4 to get used to it because
it feels a little funny.
Yeah, because level 2 and level 3 are pretty strong.
Okay, Mia? Do you want to give us a good tip for cleaning your Invisalign or remembering to wear it? Or some other type of advice for somebody?
When you first get it, eat applesauce and yogurt and stuff.
Soft foods, right? While you're adjusting to it because you're sore and it's hard to chew and everything gets stuck and you're like, get it out. Lily?
I recommend taking an Invisalign case everywhere because it's way easier than putting it in napkins or putting your Invisalign on a plate or a placemat.
Totally. Mia?
When you get used to the expander, it will feel, sometimes it might feel it's not there. Yeah.
Oh, you forget it's in your mouth.
Yeah.
That's great. I think everyone looks forward to that part. Yes, Lily.
The part in the middle where you turn it, there's this sharp thing on it. So don't touch it with your tongue because it will cut it.
Do you mean on the metal piece that turns?
In the middle.
Got it. Interesting. Okay. I love hearing what you guys have to share. This is just a reminder that with the right support and team, kids can handle these treatments so well. You guys did amazing with them. You're still doing amazing. And it's not just about straight teeth. It's about breathing, sleeping, and growing healthy. So we're going to start to wrap up. So you guys can each share one last thing. Mia, what would you like to share?
Well, I was going to say, if you wore the topping like this, how's it all?
That sounds stitch a little bit. Was that your goal, Lily?
It actually doesn't hurt when they're putting the in or taking it out. It just, when they're taking it out, it might feel a little uncomfortable because they're picking at your teeth with it.
Well, they have to get it secured to your teeth, right? So they have to break it.
And when they're putting it in, it's really not that bad. They're just pushing it up into your teeth, which might take a few minutes. It might feel tight, but it actually doesn't.
Amazing. Mia, last thing.
So when they're putting it in, it might taste bad because they use this glue that tastes weird.
True. Just be aware.
Yeah.
Yeah. Anyways, I am so proud of both of you. You both have handled your whole expansion process. I mean, Lily, this is the 3rd time you've been in expansion. Mia, this is the 2nd time you've been in expansion. You've handled your expanders, your Invisalign, all the appointments, champs. You guys are the best the best patients. So thank you guys for sharing your experience today with our listeners. I think it's really going to help other families know what to expect. I think it helps when other kids can also hear what you guys have to share. And to our listeners, thank you for tuning into this special family update. If you're curious about airway health expanders, clear aligners for kids, we hope this gives you a little peek behind the scenes, of what the process looks like in real life. As always, if you guys have questions, whether you have questions or your kids have questions, you can always meet at Bulkin on Instagram. I'm happy to answer the questions in DM or on stories or even do a podcast episode. So don't be shy. Reach out. Let me know what questions you have about this, especially if you're considering it for yourself or your child and you're just like, I have so many questions, I don't know where to go. You're not the only one. And I'm always happy to share more if there's other things you want to know. So that's all we've got. This is Hallie and signing off. Bye, guys.
So will you share with everybody a little bit about what is it? I know we're going to do I forget the whole name of it, but split the suture. People are asking, do you split it all the way? Do you only split it partially? And then, because I have friends who have gone into me and they don't have that done. They just have the appliance put in and then it splits on its own. So indulge us. Tell us all the things.
Okay. I have a companion here. It's just easier to explain all that. So what doesn't, because we're diving so deep into this in our practice, we deal with this every single day from 9 to 5. And we have initiated research and published one article, a specific design that was shown to produce a lot of facial changes besides just having the mid-palatal split. And if we look, this guy, the yellow zone is so this big yellow bone is connecting to zygomas, to frontal bone, to some bones inside the orbit. And all of those connections, all those sutures that we see here, they exist in our skulls. They haven't fully fused and they are being disconnected during the course of treatment. Also, because the heart has several bones, what we anticipate is that you see this yellow bone is the same bone that we're expanding, but there's also another bone, which is a palatine bone. So this area behind it will be the part of the airway. While the nasal passages are horizontal part of the airway, then it just proceeds into this vertical part, which is located here in our throat. So we have the whole purpose of what we're doing in a context of sleep apnea and breathing and sleep disordered breathing and recovering that normal breathing in our bodies is to have the pressure within the system equal and not positive, so that there is no resistance from the atmospheric pressure to go and to access the system. So it has to be some sort of a very, very mild negative pressure that is kind of sucking this air into the system. So that's why all of the parts of the airway have to be enough with less resistance from the surrounding tissues, muscles, and mucosa that do not restrict this airflow. And that all starts with the nasal passages. So if we expand that by doing, which physically expands the palatal suture and expands the nasal passages, that was shown in multiple research articles. So that increases the physical size of the nasal cavity. And the most important part, so you address this very important question, does it open all the way? The approach that we preach and that we follow is this yellow bone from the very beginning, from where it connects to the teeth, to the very end of it, where the, I would say, maroon is. So it has to split all the way back. And what we found with this combination of piezo is that once this split happens all the way to the back, that drags the side walls of the nasopharynx, velopharynx, and it increases the size of this pharyngeal airway space because those muscles are connected to that maroon bone and they make up the walls of the nasopharynx and an oropharynx. So that the size of the airways sideways, it increases not the posterior size of the airway, but it increases the lateral size of the airway. And again, we have a lot of research showing that in adults, the benefits of so-called mandibular advancement, the appliances that are used to treat the sleep apnea, they increase the lateral size of the airways rather than the sagittal. So what we are used to measure as this linear AP dimension is not something that actually needs to be measured because that doesn't change much. What changes is the cross-section and the volume and the lateral size. This is what gives more room for the air to pass through the system.
Okay, that's interesting. So in where people are left to split on their own, are they splitting usually all the way back, or are they only splitting to the point of the maroon bone that you showed us on the skeleton?
Usually, again, so that depends on this type of the screw used. In most of the screws used previously, the split was a triangular, a V-shaped split that ended where the suture between the yellow and the maroon bone was, and never. Now, when we added this, we make sure that it splits all the way parallel in a nice parallel fashion with even spaces everywhere from this point, we call it under the nose point, from PNS, which is the most posterior point of the palate. So that's the whole purpose, to have a nice parallel and even expansion.
Got it. Okay. So then with this procedure, people were asking, will there be, because you're doing it, will there be less pressure in the beginning? I mean, obviously there's discomfort when you put any appliance in this, and to adjust to it and everything. But in terms of that pressure, because you're doing the splitting, is there less pressure?
Because I have this appliance, I can tell it from my own experience. So I have aligners in my mouth and I have MARPE in my mouth, I have everything. So the appliance, when you put the appliance in, when you do that is all covered under the same local anesthesia. So you don't feel the difference whether you do or not. So you're anesthetized, you're numb, you don't feel anything. Yes, you are under some recovery sensation for a day or two. When the anesthesia wears off, you feel some soreness, just somebody rips their skin on the knee. And this is a healing process. After that, when you proceed with the turn doesn't feel pain or any sort of discomfort. It just feels a little bit of pressure. You feel it in your face, you feel it under the nose, you feel it around the nose, but it's not, I would say, a pain or a discomfort. You just know that something is happening. It presses on the surrounding structures, on the bones, and what happens is that this whole mid-face, this whole yellow area, it just goes forward and outward, and we get more fullness to our face with this procedure, because it ensures that it detaches from this red bone, which is right here. Red bone is the bone, which is this bone is the bone of the base of the skull. So when that happens with piezo, that detaches this whole thing, and this slides a little bit forward. So that is being squeezed slightly forward, and we get more fullness to the face because of that.
Trying to think of what else people were asking. So the mini screw, I guess one of the biggest differences versus rapid palatal expanders that are out there, right, is that this is physically screwed into and helps to split the suture line, which does not typically happen for adults. Maybe without the screws in place, we're not going to get the same results, right?
Yeah.
You should typically tip teeth if you have an expander as an adult without the mini screws.
Correct. Yeah.
Okay. And then at what age do you feel most kids can still do the traditional rapid expander, not traditional, but what Lily and Mia have versus needing the screws, age tipping point?
That's an amazing question. So I usually look at the dental development and the facial development overall and the teeth. So on average, 10, 11 years old is the cutoff point when I would rather go with a screw retained appliance rather than the regular expander. Not because the suture is fully developed, but the suture starts fusing, and that fusing is still linear. So it's just two halves of the maxilla, they just touch in a linear fashion. The more mature we become, the more we develop between the two halves of the maxilla. So that becomes way, way more complicated in an adult. So if I see that a child still retains their baby teeth, the second molars, and even the first molars, which are supposed to be lost by 9, 10 years old, then I feel we can still try to go with a regular, I would say, type of expander, not screw. But again, the point is not the choice of, but the outcome that we want to achieve. The outcome is the bone split. If we can achieve bone split without the screws, perfect. And the bone split that we are looking for at this age that makes a lot of difference is anywhere from 3 to 5 millimeters of bone separation. Here we're just mentioning this nice and parallel split, so along the palatal suture everywhere. That gives a huge difference. And research has shown that with 3 millimeters and up, 3, 4, 5 and up millimeters of separation, this is what increases the actual nasal passages, volume, and the airway, the oropharyngeal, nasopharyngeal volume. So we do this not because we want to increase the intermolar width. Partially that improves the tongue positioning, but when you stretch the bones, that also lowers the palatal vault down. That makes it more, that it puts it down in a closer proximity to the tongue. So when we start developing this suction with the tongue, it's easier to develop it. You put less effort. So when we see children who struggle with their suction and we see a high vaulted palate, yes, I know that this child will have difficulties with their nasal breathing and with the suction because the tongue is being collapsed backwards and obstructing this airway. So expansion will go first, and then complemented by myofunctional therapy will get us to the best results.
Yeah, absolutely. And with your adults, are you also having them then go through after?
Absolutely.
Yeah.
Absolutely.
So a couple other things. So one thing is then the timeline for an adult. So in my case, using my case as an example, you share with everybody what is the timeline for how long do you typically turn the appliance, and then I know you mentioned it at some point you remove the bands from the teeth, but you keep the appliance in the still while I begin Invisalign, and I'll have the Invisalign on the bottom as well. And then so that whole timeline. And side note, Invisalign, because people know I've done it before. When I did do it after my last expansion, it actually retracted me at the end. So in order to close the gaps, there was some retraction. Everyone's don't do the last 2 to 3 trays. And that was right after I'd finished the last 2 to 3 trays. So joke's on me. But I know you have a very specific procedure that you use in order to move the teeth forward one by one to close those gaps, but also to make sure we don't have any retraction. So I'd love for you to just kind of share timeline, share the procedures so that we don't get retracted and all that fun stuff.
Perfect. So with this, just to make it clear, when the appliance works, it produces more of the dental tipping, and the spaces that they develop in between the teeth more or less evenly, especially where the back teeth are. So we got that tipping, and then in order to close the spaces, we have to retract that tipping. So that kind of reverses it a little bit. In order to overcome this, it has to be either, so the teeth should be moved or closed in some different fashion. So it also depends on how you activate those aligners and how you request that space closure. So let's go back to the timeline. Again, we have developed our own timeline. It might be very different from what other providers do, but this is something that we are really proud of because we combine the direct printed aligners with this innovative guided, because we know where the nasal septum is, and that helps to avoid the side effects of having the nasal septum being dragged to one side rather than stay in the middle. So that is the big part that the guided kit overcomes, this kind of opening, and ensuring that the nasal septum remains in the middle. The timeline, we start expanding the bottom from the very beginning, so we don't wait until we get some sort of expansion to start matching it. We know that we're aiming at a certain number of millimeters to those outcomes that we're anticipating. So improvement in nasal breathing, getting rid of that post-nasal drip, and making more room for your tongue while maintaining the nice upright position for the teeth rather than having that buccal tipping of the teeth. So we start expanding the bottom. So big thing is that we have two options. We have Invisalign itself, which is the thermoplastic aligners, or we do have the direct printed aligners that are made of a different material, and we print them directly in our office. I move teeth myself, so I know where the teeth are. We have the CBCT merged over the scans, and I literally move teeth with my hands and with them. So when we do that, I see where the teeth, and usually mandibular teeth, are inclined inward. And again, I'm exaggerating that, but when you just look at this is the trajectory between the two lingually inclined mandibular teeth. And once you upright them, you have the increased space. This trajectory becomes way wider. So the question is how to activate those mandibular teeth in order to get this nice, with the root being in its place, but the crown tipping. So that is, orthodontists know that this is more of a trickier movement because you have to apply controlled tipping, and that is a more sophisticated movement rather than the regular tipping. So that is something that we do for the mandibular advancement. We combine this type of movement for mandibular expansion, So this is one sort of movement. And we also do protrude those molars, which drags bone along with them, and that remodels the outer the outer surface of the mandible. So that is done in a sequential manner, and that drags bone while expanding. It happens at a slower fashion compared to the top, because the top usually takes around, on average, anywhere 8 to maybe 10 weeks of expansion. We start with 1 turn a day, then we can either keep up with 1 turn a day, or we can slow down a little bit to a little bit slower rate of expanding. This particular screw that we're using gives only 0.1 millimeters, so 1/10 of a millimeter per turn. So it's very, very slow. There are appliances that are also called that use an activation screw, the screw itself, that gives 0.2 or 0.25 millimeters of expansion. So that is almost 3 times more than this one. So that is the least that we can get. We can redistribute that expansion over time, or we can just slow down to every other day or once in 3 days. That brings us to a lower rate of activation. But again, I believe that in your case, we will start with 1 turn per day. And then once the split happens, then we will slow down, just because you did have this rhinoplasty and septoplasty, just to be a little bit slower, because we anticipate movement here in this area. And I want to track that and check it a little bit closer, so that everything happens in a slower pattern. And again, when we do expansion, we anticipate all movements here, even in the sutures that are not directly connected to them. So this is the frontal bone, and this is the zygomatic bone. While writing the most recent article, we did some research with superimpositions before and after, so that showed movement even in this area. So movement of the zygomatic bone, dark purple bone that goes a little bit sideways, and also that affects the suture as well. So everything in the face is being affected in a good way and developed. So the overall treatment duration is about 2 years. This is what to expect from it. And the mandibular advancement is a huge part of the procedure. So even though it may not appear someone needs a mandibular advancement, but just because we're developing the midface and we're moving all the teeth to close the spaces to overcome that retraction, we're moving with this direct aligners approach towards the midline, and we redistribute those spaces when finally we just get rid of those spaces because all the teeth are being moved forward.
Amazing. Thank you. And so then at what point, is it right after we complete the turning that you take the bands off the teeth and we go into the direct aligners on the upper?
Correct.
Okay.
Yeah. The other thing is that some patients, they just ask for more of a aesthetic option while expanding. They don't want to show off their gaps and they too much and get questions. So we do have aesthetic bondings when we just add composite and make teeth a little bit wider and longer, proportionally looking nice and proportionally and pleasing, so that it does not attract that much of attention. While when closing the space, we just gradually remove and reduce that composite and keep closing the spaces. So you see.
Okay, amazing. And so then at what point does the appliance come out of the Foley?
Okay. So let's say we expanded and that took around 8 to 10 weeks on average. Then we remove the arms. Then this middle part, which is attached with the screws to the palatal bone, that remains for another 6 to 7 months. Again, most of the research says that it takes around 6 months for the bone to fully fuse. What we have noticed is that the bone, which is right under the nose, this part, and the bone which is in the back, this maroon bone is, so that bone fuses the first, while the bone which is in the very middle, just because there is a lot of forces that concentrate in this part of the palate, and that is one of the counter forces of the skull. So that remains fused, or it fuses a little bit later down the road. So what I've noticed with our observations is that part in particular fuses around maybe 10 to 12 months after we completed the expansion. So we will have most of the palate fused. It could be that the x-ray just doesn't show this solid and thick bone that we expect there to see, but the bone is there while it's still being shaped, formed. Why? Because the center of the resistance of this whole midface is located in that mid area between the second third of the palate. So it's just because of the forces and clenching forces and all of the forces, they keep reshaping this part.
Amazing. Okay. So now when it comes to, you've talked about how there are different types of appliances or different approaches and everything. Does the appliance that you use or the procedure that you use have a specific name to it that differentiates it from other things out there? If someone's, oh, I want what you do, other than coming to you, obviously, do you know what I mean? Is there a procedure, process, something that's very specifically different?
So while we still call it, we always add this 3D guided. So it's guided, it's different, maybe but it's guided. So it's different in this way. And also the protocols that also aims at the facial development. So we have applied for the trademark, which is the face that produces those positive facial changes. And that shows that it's not only about increased nasal congestion improvement, this subjective symptoms, the resistance improvement, which is the objective, obviously, and it just helps move the mid face forward and then to advance the mandible. So that protocol is different because we're not retracting anything backwards. And the biggest part of it, we don't use braces for this. We always do all the orthodontic part of it with aligners because aligners have more capacity to be designed and planned into development and movement rather than keeping everything together and close. Braces do.
Somebody asked me, they've heard about sometimes the mini screws or the TADs not succeeding in some people. Is that something that you've run into a bit? Is it not really that big of a concern?
If we're talking about being mobile or loosening up down the road, it depends on how long the appliance is in place. What we see just because of the remodeling. So if the middle part of the appliance is maintained there for too long, just because of the remodeling, some of the screws 10, 12 months down the road, they can become loose. And that is obvious. We understand why. They may become loose in younger patients, teenagers, because of the very fast metabolic processes and active bone growth. So this is more likely, and it happens in teenagers. It very rarely happens in adults, especially because of the solid bone, the bone which is already grown, the screws with adequate length that is enough to engage it, and just the process of treatment planning and the positioning of the screws. So angulation and engaging thick bone, we call it cortical plates. So it's a very rare, almost it does not happen in adult patients.
Good to know. So one, you do everything in office and you guys have a separate room for that. Can you just share a little bit about that?
Yeah, so all the procedure itself takes, I would say, maybe 30 minutes. Then we talk for another 10 minutes and we take records just to document everything and that our patients are confident that the procedure went well, everything is in place as planned. So everything is, of course, it's sterilized, disinfected, all the appliances come sterilized and all the screws come sterilized. So all of this. And I would not say that this is a surgical procedure. It sounds it is, but it's maybe less invasive, or it could be compared to the ear piercing. So something that just because, yes, you have to penetrate normal tissues, soft tissues, the bone, but it's very similar. So under disinfection and sterilization procedures, it's completely safe, and there are very minimal side effects or almost non-side effects to this procedure in terms of the placement of the appliance. Patients have to be careful in terms of not irrigating, not using water pick too much because the tissues are fragile, so they may bleed a little bit. So we advise against using water pick for the first week. We advise using just natural rinses, warm water, salt rinse, and keeping it. And this helps with shrinking the tissue and healing it. We do not start with until the tissue after it fully heals. So that takes us a week away from the procedure. And this is when we start turning. So we don't get a gap. We don't have a hole in our mouth that we can feel it with. It feels very normal. It feels like always. It's just, we understand that the appliance is there and there's a little bit of discomfort on how to maintain the cleanliness of the appliance and how to brush everything around. But that's the most, I would say.
That's just been the biggest, learning curve. So that's really helpful to understand and to know, because I think also for people just to know it's not this major surgical procedure that you're undergoing. It's, I think a little settling for the mind. Our question. So going back to the nose and everything, do you ever see, and I'm even wondering this because we know my maxilla is turned inwards and it's causing asymmetries. Do you ever see other asymmetries created or asymmetries that just don't improve despite getting all the other benefits just because of the shape of the face or whatever may happen?
That's another great question that is out there. If the asymmetry, so what we've noticed is that when the patient comes with initial asymmetry, so let's say one cheekbone is more prominent than the other, what happens is that expansion tends to even things out. So if one side of the face was not developed enough, by even expansion, by even and reciprocal expansion, because you're not activating one side more than the other. You don't. You just push two sides away from each other. What that does, that brings the side that was underdeveloped more forward just by detaching from the rest of the bones. What also matters is that most of the times when one side seems it's underdeveloped, it's more teeth arrangement and teeth positions inside this vertical part of the bone, the alveolar process. Teeth, their positions relative to the other side would be different. So that looks it's asymmetrical, or one side is still underdeveloped, or one side moved more than the other. But this is where this treatment planning with the direct printed aligners comes in. So I've learned so much by treatment planning myself. I have noticed so many patterns in how the jaws split by analyzing every single case, and I've come to a conclusion that most of the asymmetries are either related to the nasal septum being dragged to one side, or second is that the teeth are located at different angles and they're pushed in on one side more than the other. So when moving teeth, after you have to tackle that more rather than activating teeth in a similar manner, just braces do. Because with braces, you put a wire that is supposed to bring the teeth to a certain perimeter, to a certain shape, but the initial and baseline angulation of the teeth can be different. One tooth can be angulated more, the other could be straight, then it will be tipping here and will be tipping this even more. So they will look different at the end, and that will not be corrected. Aligners, we have more control over angulating those teeth. And when you move the root inside the bone, that reshapes the bone, and that can bring more of your skin and lip forward as well. We've seen asymmetric bites when one half of the nose was a little bit wider, one of the nose, this part, the corner of the nose was a little bit wider. And when we put the bite together, the nose became perfectly symmetrical because it was not dragged, it was not pulled by the skin, by the bite any longer. So it's a big thing.
Yeah. So anyways, last question. And then if there's anything else you want to share, please do. Started to mention certain things, some restrictions in that first week, right? We're not going to turn anything until about a week after the procedure, avoid water pick that first week, do more of the rinses. I know I was told, I think no working out for that first week. So are there, aside from foods, obviously, are there any other major restrictions or even foods you recommend as people are kind of adjusting to their new appliance?
So you will feel some, I would say maybe minor annoyance because you cannot floss in between the teeth. That was my biggest thing. I wanted to be super clean, and I was trying to get in there, even though I have this framework and that goes behind my teeth from the inside. I managed to floss it, to somehow getting from the outside and cleaning it in between. But anyway, that was my biggest thing. And I was so happy when the arms were removed after 2 months. That was the biggest thing. So that would be a challenge for the people who monitor their hygiene. So I believe that you will be struggling with this for a little while. Yes. At the very beginning, what I would say is that there are some foods that have fibers, that pineapple or maybe oranges or something that will be a little bit more difficult to clean. What I usually do, I carry those disposable toothbrushes with the toothbrushes everywhere. So I have a bunch of them in my bag. So when I eat, I just go, and I don't need a water pick at that moment. I just use the soft toothbrush over the appliance and in between the teeth. And of course, I rinse a lot because that helps the most. You kind of dislodge those pieces. I'm sorry for these details, but this is how it works. So it's not, and the biggest thing is that I snack way less, right? Which is very good for my overall health.
But so no other major restrictions. I can go back to Pilates after a week. I can,
Don't get punched in the face. That's the biggest thing.
Yeah, don't get punched in the face. I will do my best. Amazing. Well, is there anything else that you want to share about this? Or, if not, tell everybody where to find you.
I would say that was one of the biggest things I did for myself, and I'm super happy. I love the way I can breathe after all. It was very frustrating to wake up every morning and to feel congested every time I try to breathe when I'm conscious and I'm concentrating on that. I don't have this issue anymore. So that's the biggest thing. I still have a long way to go with my mandible, so I'm moving teeth with aligners. But what I can tell is that all the treatments that we offer in our practice is everything I either did my kids. They all went through that. So we know how this works, and it's human proofed. And I also do it on myself because I need to know how it feels to go through all these treatments before I offer it to my patients.
Yeah. Well, that's incredible. And I'm grateful for it. My kids are grateful for it. So thank you. So tell everybody, if they're curious to know how they could do a consult with you or where to find you, share your contact information.
Thank you for this opportunity. So we are located and we do have consults by appointments, and we do offer CBCT imaging in our office because that's a big part of the procedure. So the consultation is usually an hour long because this is how much time it usually takes to take all the records and then to discuss everything. And we have a separate room where we pull up all the records and we discuss it together. So you know what's going on with you inside your body, inside your head. And then we discuss the treatment options as well. The office is located on Military Trail. It's North Military Trail in Boca Raton. And our phone number is, we're very happy to see anyone who is interested in developing it for themselves and for their kids as well.
And you also offer myofunctional therapy in the office too,
Yes,
for your patients,
yes.
right? Yep. Yes. Well, thank you again for rejoining me, for answering all the questions. I think that everyone's going to be really excited to hear about this and then to track my case and see the results. And obviously they're going to be following for the next 2 years. So we've got a journey ahead of us. But in that time frame, I think it'll be cool for them to also see, they can go to your profile on Instagram and kind of go back and see where you started and kind of follow your journey and just even see facial changes and all the things. So I encourage everybody to go and do that and see some of the other cases you posted as well, because you've got some incredible cases just on your Instagram alone. So thank you for all the work that you do and for sharing all of that and for answering all the questions.
Thank you for having me. I appreciate this opportunity. Thank you, Hallie.
Jeannie, welcome to the podcast. I am excited to have you on here.
My nose is actually something that has not been addressed yet. And we've talked about this because my nose is actually one of my biggest problems right now and has been my whole life, and it's never been addressed. I know I have a severe deviated septum. I know there's lots of turbinates. My nose is a little asymmetrical. I'm in some ways hoping that it does change my nose and the symmetry of my face. So that's another different goal that we have.
Yeah. Do you know how many millimeters you need of expansion or how much they're going for?
So I think he's going for as much as possible. So my intramolar width is currently 27. So it's really narrow.
Yeah.
So
he may be going for 35 or, yeah.
So I think as much as it allows. So I know he's going to be closely monitoring it too, but I think he's going for as much as he can. Are you going for 35 too, or what is your end goal?
I don't even remember what my intramolar width is, but she basically was based on what I'm seeing. She's, you don't need more than 5 millimeters. So she was, it could be 5 to 7, but I think we're going for 5. So I think I am less than the average patient that comes in. But again, it's people. I was standing with an SLP colleague who's not in the myo space. We do Pilates together the other day. And she's like, so why are you doing more expansion? What is your goal? And I told her, my goals are, one, ever since the surgery, I've had this post-nasal drip. that has not left. And it's worse when I'm in recycled air. That is a big trigger for it. So if I'm sitting in a car, I'm on an airplane, it just starts going. And my husband is, you're making that schmarky sound. Why are you doing that? And because there's literally stuff falling out of the back of my nose into my throat right now. I have to swallow it. I'm constantly disgusting. I sound like a pig. So part of me is, I don't know what it is. I don't know if the nasal surgery, something sitting somewhere different, something got triggered. I don't know. Maybe it's just stimulating something to produce extra. I don't know. So it's so strange. If I use Clear, the nasal spray, then I feel it does help it a bit, but it feels more of a Band-Aid than a long-term solution. And so in my head, I've totally made this up. This is not something that has been promised to me. But in my head, I'm like, if I get that 5 more milliliters of expansion, it's going to change some things in the nasopharynx. And hopefully whatever is triggering that to happen leads to it stopping. My goal is for that to stop. I know there's no magic wand. We don't know if that'll actually happen, but I'm really hopeful that it will. And then secondly, the second one is I've been waking up with a scalloped tongue quite a bit over the past year or so. And I feel I have enough room for my tongue and my palate. I don't have that overflow when I suction my tongue because of the DNA vivos and everything. But for whatever reason, I just feel like things are not sitting where they're supposed to be. And part of that is my maxilla on the upper left side is turned inwards a little bit. And so what that I think is doing is causing asymmetry. So I'd love for those asymmetries to be addressed and fixed. And she says that, well, absolutely, that is the plan. And then the third thing is, well, and it's directly related to that, but I started to wake up and I had a couple times where I woke up and I could not open my jaw and I felt pain and discomfort in the left temporomandibular joint area, really more the muscles than the joint itself. Yes. And it's crazy because if you watch me talk, everyone's, oh, your jaw deviates to the left. Mm-hmm. What we realized is it's not, and I realized this when I was doing the DNA vivos with Manny, who was doing the PT, doing all the body work with me. We realized it's not my mandible that's off. It's my mandible is actually centered. It's deviating because of what's happening with my maxilla. So it's compensatory and secondary to what's happening with the maxilla. And the vivos just was not strong enough to open the suture. And actually, that's what we needed to do to unlock the maxilla because we tried through body work plus the appliance, all the things. So that is a big goal for me, is to unlock the maxilla. Obviously, we'll be able to separate the two sides of the palate. And then when everything heals, have it heal in the right place. For me, that's the big thing. I do feel it's so crazy to watch me talk because the asymmetries that happen are totally a result of this maxillary bone on the left side. And it's wild. Yeah.
It's so interesting. Well, and I think one big thing with all of this, and along with what you're saying, I can so relate to the reasoning for it because it's similar but slightly different. But I think a lot of people say that to you. Why are you doing that again to yourself? Orthodontics is so much more than just straight teeth. Yes. And I think being in this space, we also know super well that this is also so much more than just the muscle, because habits that we've had in our whole life. So up until we were 40, all the things that we did for so long before we got into the myospace, before we understood how the bones focus on the muscles and how all of that works, how the muscles influence the bone and how they shape. It's a lot. I mean, this is why we say it's a journey, right? It's not just a quick procedure. Just when we talk about tongue tie releases, it's not just one thing that you're doing to change the structures. It's a process, because our bodies are slowly changing and adapting always to the structures. It makes sense that it takes a while to do that.
Totally.
Well, so I'm obviously concerned about that too, because I'm not a podcast host, but my job is...
You're a speech pathologist.
Helping children speak. And I definitely have that same concern. Another thing that we haven't really talked about yet, but one of my big reasons for doing this, not only is my palate is so small, but my airway is so small. And I've been a lifelong mouth breather. I've done a lot of work with the myo portions, with my muscles, with so many things for my kids. But MARPE especially, I know, is going to just change the structure to allow my muscles to sit better, to work better, to help me breathe better night and day. And I do have OSA, so I do have sleep apnea. I'm not using I'm blanking on what it's called. The
like a sleep apnea machine. Yeah. CPAP. I'm like, why can't I think of the word?
I'm like, people use this all the time. Why can't we think of that word?
Sleep apnea machine. I had to circumlocute to get the actual term. Yeah, it's okay.
Yes, so CPAP. I'm not on a CPAP, but I do all the things at night. Like currently, my nightly routine is I do the clear in my nose. I do intake breathing strips so my nose is wider. I do this whole like breathing routine. And then I mouth tape with like the myo tape around my mouth, but I'd say 5 nights out of 7, I rip it off. And it's just because I simply cannot get enough air. And like, I know it starts in my nose and where it is. So like, I'm really excited to have more room in my nose, to have more room for my tongue. That's another thing that I think I probably hyper focus on as a speech pathologist and a feeding therapist. But the way I chew and swallow, my swallow reflex is triggered quicker because I don't have this room in my palate. And again, I think some people probably couldn't articulate that, but I know that I pocket food. I know food gets pushed back quicker than it should. And maybe I'm making that up, but like, I feel like that has to be related, right? Like if you have more space, you have more room to chew, you have more room to like hold on to the food and to chew it versus just like controlling it back. I'm like, right. Yeah. So, and obviously I accommodate with like small bites and like cutting up food and trying to take my time. But at some point your body takes over and it's just like, nope, we're just going to swallow it down.
Yeah.
So, yeah.
It'll be interesting to like hear how things are going. Obviously, I feel like that's not something you're going to really know until it comes out and you can actually swallow without a big appliance in your mouth again. Right. But speaking to the airway, actually my airway, and it's like I forget this, which is kind of funny, not funny. Parts of my airway are okay and other parts are looking very narrow. And that was also why she was like, yes, you can totally benefit. And I do recommend that you have more expansion, right? Like that's another reason. So I should probably add that into my list. It's funny until you said that I hadn't thought about it. But she and I talked about it when we were recording, and she was saying how like a lot of us are so hyper focused on like the AP, like anterior posterior growth and getting the jaws forward. And she's like, that is important. She's like, but she's like, the research even is just showing that like lateral growth, right, of like the expansion of the palate opens the airway so much more. And so that's like super, super critical. It's all important, but I think it's very interesting because she was talking about like the different, planes and everything and how we really want to focus, on not just the AP, which I think there's so much talk about right now, but also on like the sagittal plane, which is kind of like that, the side to side.
Well, that makes sense to me for chewing and swallowing more than, which I think is kind of what you're getting to. Like, I think that makes more sense to me, or even from the myo perspective, when we're giving exercises to widen, narrow the tongue or lateralize the tongue, we need that width. And I can also relate to that. And you talked about scalloping too. I definitely get tongue scalloping, and I almost feel like it's unavoidable. Like no matter how much I work the muscles, no matter how much I work my tongue, like my tongue is in great shape. Like my tongue is doing awesome, but I cannot get the space that I need with the way it's sitting.
Well, and that's like airway, right? It's like airway, tongue space, like all the things. And like to your point, right? So like if we're looking at it like the sagittal, like kind of left to right or whatever, the tongue, like protrusion and retraction, we talk a lot about that. I do feel like the width impacts that. So even though it might be like an AP movement, like it totally impacts our ability to move our tongue. Like when we're doing any tongue grooving and, when you're trying, like you were talking about it impacting your swallow, when we're kind of grooving the tongue a little bit and shaping it to the palate to swallow food back, like we need that lateral growth in order to get the tongue where it needs to be. So anyways, I feel like it also impacts like how we open and close our jaw, and how, even our soft palate, I think also is then impacted on like the elevation and depression of the soft palate, which I think for us SLPs, it's always interesting to like hear how people say certain sounds like in the back of the throat, right? Like the and unga. It's interesting because it took me a long time as a newer myotherapist to like hear people say that and start to hear the difference between how people were producing it and be like, I don't know if they're like moving their velum like the way they should be able to. And is it a tongue issue? Is it a velum issue? Like, I don't know. But for the soft palate, we know it has to move to close off the nasopharynx to produce certain sounds. And I do think for a lot of us, like that also is impacted. So it's very interesting when you start to like look at, like you task analyze, right? And you look at all these different things broken down and how just like one seemingly small issue seems to impact so much.
Yeah. And the maxillary bone too, I think is something that we talk about a lot, but I'm also curious if it'll impact even vision things. So because that's something that we don't talk about so much when we're talking about the mouths and we're talking about the nose, but the maxillary bone, goes right under your eye socket. So like, one thing that I have is I have double vision. So I have to have a prism in my glasses. So I can't even wear, I can't wear contacts because of the way my vision is. And I have done some vision therapy. I've kind of paused that for a moment just because of the time commitment. I mean, it's like
all the changes. Yeah.
So much. And then also with this, I'm wondering how that's going to change things because we're really moving like, cranial bones here. So how is that going to impact how my eyes sit, how we exercise our eyes too. So that's another one that I'm curious about.
Dr. Koval was actually talking about that when we recorded. So she was mentioning that like she sees changes in people's eyes because of the sutures between, the maxilla, the mid-palatal, just all the mid-palatal suture, obviously. What else was she talking about? She was talking about like you were talking about the like the orbits, of our eye, nasal cavity, all the things, right? So she basically was saying that like it is so anatomically close, but also when like these sutures, here shift, there's sutures also here, and she's like she sees like the eyes, I don't want to say get wider necessarily, but I do feel like there's like expansion, like the face changes. And if you look at people that have had MARPE, sometimes their eyes look more open, like they look brighter, more awake, so I've definitely seen, like when you look at pictures, I've seen changes. And I do feel like she was, I don't know if she was alluding to it or if she outright said it, but I think she was saying like they do see like growth there as well and like shifting, but in a good way. You know what I mean? Like, and through like that cheekbone area. And that's where you see people get like better development of the bones in their face. It almost looks like they all of a sudden have like more definition, which I did get. I got that when I did my Vivos DNA. Like I developed cheekbones that I did not have before. So I'm like, ooh, am I going to get more cheekbone? Like
that's nice. Yeah, no, I'm excited about all of it. Like just all the changes I think will be positive. Even though, like we said, the journey is a few steps back to get the ultimate goal, but I'm excited.
I remember what she was saying, actually. She was talking about how like we always talk about the floor of our nose being like the roof of the mouth. She was talking about how like the floor of the orbit, like the eye socket, area, I mean, maybe it's not eye socket, that might be the right term or whatever, but is formed by like the roof of the maxillary sinus. So that's what it was. And so that's where she was saying that you can definitely get the changes because of just like you're talking about, like the shifting and the sutures, like everything is so fluid. And I think a lot of people think that everything is super fused in adults. And she's like, no, everything is still so fluid. And those sutures, we have different sutures in the cranial bones and things shift. And I'm like, it's kind of cool. So it'll be cool to see like if like the width, like the orbital width changes or, if it changes how you're seeing things. I'm like so curious about this now.
I know, right? There's so much to it and like it's going to be so fascinating. I'm looking forward to just like really having like it's like a study buddy, but like having like a partner like doing this. It relieves a lot of my nerves because I just feel like it is a terrifying procedure to go through. But I have so many hopes for big changes with it. I think it's really going to be impactful.
There is somebody that I have known through the Myo world who just got her MARPE put in this past week. And so like she was like talking about it, and I think she didn't have it split with like the piezo like I'm having. It's more I think like yours, and I think she'll also probably do the braces, but I don't think she went right into braces right away. I could be wrong. But anyways, she was like talking about, it just feels like a lot of pressure because the suture hasn't split yet and all of that. And so I think it'll be cool for us to like compare what that feels like, looks like, since that part's definitely different. And then, we'll just, I don't know, but I feel like we need to like create something where we can like document daily. So we have like these interesting comparisons to, because when I did my nasal procedure, I was just keeping a list of like signs and symptoms every day and like how things were changing. And I just was taking photos as well to like document. And then I did a training on it in the membership where I was like, okay, this is basically, the first 60, 90, whatever it was, days, post-op, which was interesting. But I feel like if I had something like that to watch right now, like for somebody's MARPE journey, I think I would feel Like, I feel like 100 times better after talking to her yesterday, but I'm still like, it's the unknown of a procedure and something going into my mouth. And like you talked about, like for our work, like we need to be able to speak. So there's that.
Yes. Yeah. It's going to be interesting. My hope is that like, that because of our work, it can be like a hope for other people going through these things. Like, so even if they're not doing this as their profession, just to say like, okay, if she does it as her profession, obviously there's some truth behind this. Obviously this is a good way to like, to move bone, to shift bone, and also to like have big impact on function and just how just the structures can change the function, especially when you address the function from a muscular standpoint in therapy and then moving it and shifting it with the bone, with the structures. So I'm hoping that it's just like a goal for other people to be like, wow, like look what that did and like how it impacted and how it helped.
And if nothing else, you'll be able to relate better to some of your little speech kiddos, and they're going to think it's hilarious that, Miss Jeannie can't talk well, and, maybe they can be the therapist for you. We'll see.
Right. That's always a fun game to play in therapy, right?
Yeah. Hey, can you tell me how you do that? Because I can't put my tongue up there. So how do you make that sound so well?
Right.
What's your strategy?
Right.
Oh my gosh.
It's going to be so interesting. Well,
are you like ready for the food part of it? Because I'm like, I don't even know what I'm going to eat in the first week.
So I literally was just having a conversation with ChatGPT about this, about like pureed, soft, solid foods that are going to be comfortable for that. This weekend, I'm planning on making some soups. It's really hot here, and I know it's hot where you are too. I'm in Phoenix, Arizona, so it's pretty hot here.
Yeah.
But I'm thinking of making some like soups. I'm thinking smoothies. I'm thinking, just like that's my plan, at least for the first like week or so while I'm so tender, because I'm really nervous about the tender part. And you touched on this too. I have a pretty high tolerance for pain. I've done 2 unmedicated childbirths, so I'm like, I think I can handle anything at this point. However, it's just the pain doesn't seem fun. Like it seems really hard. But so I have like a little list. So I'll have to share it with you what I found. But ChatGPT was helpful with that. But yeah, and did your doctor talk to you about how long you accommodate food things? Because I mean, the other thing is, again, having braces 3 times, I'm very familiar with foods you can and can't eat with braces. I mean,
Right, you got braces. Yeah.
It's been like 20 years since I've had braces, but I know so many things can get stuck and like, can change the way things move in your mouth. But
I'm like looking at my notes as you're asking me that, because I'm like, I feel like I wrote something down somewhere because I had some ideas, and now I'm not seeing any of my ideas here. I think I like crumpled them up. But anywho, so because of the piezo and like I can't use the water pick for the first week, so like I don't want to eat anything that's going to get stuck up there. And so she was suggesting to me, like especially in the beginning, like avoid things that are more acidic, avoid like if you're going to eat fruits, make sure it's not like a pineapple or something that's going to have like it's going to be stringy, because like you can't. She said for her it was like the hardest thing was like being a dentist and wanting to be able to like floss your teeth, and like you like literally you can't floss, like you can't get the floss up there. And with braces, like you're going to be able to floss, between some of your teeth, but the area where like the brackets are around your teeth for the MARPE, like she's like, and I actually have, this is one thing that I'm like, think will drive me crazy. I have like a pocket where I've now had, a filling on my back tooth, and there's like a pocket between the teeth. And so I'm constantly having to like pull food out of it, like no matter like what I eat. And so I'm like, oh my gosh, like, I don't think this is going to fill that. So like, how am I going to like this? And sometimes it's like uncomfortable. So I'm like, how am I going to get this out? And I try to keep it so clean so I don't have that issue. And I'm like, well, maybe they'll put a bracket around it and like fill it with something that'll like close that space. I don't know. I have to like tell her about that. But I'm like, she's like, one thing she told me was she keeps like a soft toothbrush with her, and like a travel one that's like got like toothpaste on it or whatever. You don't have to like carry toothpaste. And so she's like, she'll open that and it's like baby soft, like super soft. And she'll just kind of go in after she eats and just like lightly brush the appliance and everything to kind of just keep it clean and make it feel like, like, cause you're probably not going to be walking around the water pick all the time. Right. So if you're home or you're at work, maybe you have it with you, but like if you're out at a restaurant and you're like, oh my God, this is driving me crazy. Like when you whip a water pick out of your purse, I don't know. They do have, they have the ones you can travel with, but are you going to do that in a public bathroom? No. Yeah. But I do feel like it's more common that people will like pull out a toothbrush and like brush their teeth in a public bathroom. So she's like, you do that. And it's kind of like a throwaway thing. So I was like, that's an idea. Like I hadn't really thought about that, but that's just the biggest thing is like, I know my kids like they didn't have MARPE, but they had rapid palatal expanders with her. And at first it was so close to the top of their palates, even though their palates were high, that it was like, and theirs has like, they have like a modified Haas. So there's like material, there's like the plastic or whatever it is on it in addition to the metal. And so things would get super stuck. And we were using like some of those, little bendable thingies that you can stick between your teeth or between the palate to like remove the food. But I'm going to have an open, like I think it'll be open down my suture line at first. And I'm like, I don't want to be sticking anything up there. So I don't know. That's the one thing where I'm like, I don't really, she was like saying salt rinses for me will be really helpful for that and keeping that clean. And so, yeah, I don't know. I'm like, I just got back from Italy. I think I gained 7 pounds. We're just going to go on a liquid puree diet for at least a week and we'll see what happens from there.
That's pretty much my plan for a little bit. But especially with that suture ahead of time, I feel like you really have to be, especially with like acidic things, because that would hurt with an open wound. So I'm wondering with mine though, like eventually there's going to be an open wound, right? Or no? Like when it does split?
I don't think so, because I don't think the skin ever like gets cut. I think the skin just kind of stretches, right? So I think it's like the skin is still there. So even though the bone may be moving apart, I think that it's never like an open wound, if you will. And I think that's maybe the one difference. And I mean, the mouth heals so fast. So I think it's going to be totally fine. But I'm still a little unsure about like what that looks like. And like, I'm like, am I going to have a hole in my mouth? Like, what? I don't know. Because I think if they go through and they do split it, I don't think it's not like it creates a big gap from the beginning. So I think everything's still like kind of like very close together. And it's just a matter of the skin healing. And then we start cranking the appliance to move the bone. So
yeah. Do you have body work plans like while you're on this journey, pre and post? Like what is your plan with like
I need to. I haven't done it yet.
Okay, well, so one thing that's different about my practice is I also do craniosacral fascial therapy and then manual therapy as it relates to the structures of the mouth, face, jaw. And so that's something that I have been prepping myself for. So I've been doing some CFT sessions, not on myself, like I have someone who's doing it for me, chiropractic work. The day after I get my MARPE, I'm getting a lymphatic massage. So I'm planning on doing that just because I'm not working that day and I'm like, I'm just going to rest.
That's a good idea.
Try to not talk, but yeah, like, so maybe, and again, lymphatic, I guess I'm just thinking that like when you have any kind of like intrusion in your body, the lymph system is going to be heightened.
Totally. I feel like it goes in like to protective mode and things start to, swell up a little bit to protect you.
Right.
Yeah. Holds on to the fluids.
But I feel like that's something that I'm really going to try to focus on as I'm doing this, is to dress the whole body too, because there's so much to that.
I need to.
Yeah.
I need to. Yeah. I feel like, I've had some massages and some body work and stuff like in the past couple of months. I've not been doing cranial. Like I have not been to CFT, CST or chiro or anything lately, but there is somebody who does the craniosacral work here that's like highly recommended. So I need to call her and see if like I can get in with her. The other thing, I'm not allowed to work out for a week because of the suture line cut. Sure. So I also was like, am I going to be allowed, like, is it a good idea to like lay face down on like a massage bed? I don't know. I need to ask her. So I might like go message her after we wrap up. So I know if I can like what I can schedule even, because I'm sure it'll be fine to like lay on my back, but I'm like to lay on my, like with face down, I'm like, would that put pressure on anything that might not be a good idea? I don't know. I'm like, if they don't want me doing Pilates for a week, like can I lay face down? Who knows?
That's a good question. I hadn't thought about that. The lymphatic massage place that I go to, and I don't know if this is the same for all places, but they do a lot of it when your back is like you're facing up. So I wonder if that's maybe even an accommodation that I'll make for that.
Probably. I'm sure that they could definitely accommodate. Yeah.
But that's a good point. Like, I wonder if laying down would be negative or not something that's optimal.
I mean, I think for you, it's probably totally fine because you're splitting the suture yourself.
Sure. Yes,
I think it's just because I'm having it split for me. Like,
Yeah.
part of me is like, I just want to get everything cleared. You know what I mean? Like, if she's like, oh, yeah, no problem, like, you're good.
Yeah.
Or like, oh, that might be too much like pressure on the facial bones because your face is literally like in that circle thing. And I always feel like it's uncomfortable. So
I'm glad to hear that, because I always feel that too. I'm like, it's just never like perfect, right?
and depending on the place where I go, I sometimes wake up with like the line on my forehead that stays for 7 hours. And my husband's like, are you really going to go in public like that? I'm like, well, what else am I going to do? Like,
I can't
Yeah.
do anything, but it felt really good.
exactly. Oh my gosh. Yeah. Is there anything else that you're doing or?
So no, like those are the main things. Like I am going to try to like focus on the body work piece, doing craniosacral fascial. I do have a PT that I work with who's PRI trained. So I'm going to be working with her throughout the journey. I am trying to do all the things. You know, I feel like as we learn more, we always learn more. And then it's going to be like, oh, I should have done this. But
Yeah.
I think those are going to be the big things. Like, I mean, I'm trusting the process. I'm trusting my ortho. And then I'm really excited just for the more space. But I think those are the big things that I'm
Exciting. How frequently do you think you'll be doing like the different types of body work?
So right after I am getting that massage, the day after, I'm planning on doing some kind of body work, something while I'm turning it weekly. So I'm planning on doing that. I'm going to up my chiropractic, I think twice a week while I'm doing it, because those adjustments are so quick. And then as it's just sitting in there and I'm healing, I don't know if I'll do weekly. I might space it out some more, like, but I have not come up with like a protocol exactly on that yet. But
Okay.
so TBD. But
Yeah, I want to go message them and ask them about like, you know, face down. Do you guys have any suggested protocols for body work? Like, is that something you're going to give me next week? I don't know. So yeah.
This is one of those things in this airway space that I think we're learning more and more about, just like how much it all is connected. I mean, like I know
Totally.
down to your feet, down to your hips, like all of it is related. So like if we're shifting this bone, how else is it going to impact the other parts of the body, and how can we keep it in alignment and keep it optimally functioning, especially when we're doing like such delicate things in this area. But so I'm kind of using myself as a case study, I guess, because there's not a protocol for it. You know, like there's not like, oh, you need to do this because of this and this study, or like these thousands of people that have been through it before. I mean, MARPE is, I feel like, how new is it? I feel like it's fairly new, like not.
I don't even know. Let me see if I can get a quick answer on that.
Yeah, but all that to say, like I don't feel like it's something that's like widely talked about or studied, but I think it's going to have. Yeah,
because I mean, expansion's been around for a while, but as far as MARPE goes,
but MARPE,
early 2000s.
Okay.
Yeah, it says initial studies on bone-borne RPE began in South Korea and the U.S. Dr. Won Moon at UCLA becomes one of the pioneers in clinical development of MARPE. Mid-2000s to 2010s, widespread research in skeletal expansion in non-growing patients. Clinical protocols, CBCT image studies validate its effectiveness. 2010 to present, MARPE gains global adoption as a minimally invasive alternative to SARPE, and particularly used for adults 16 to 40s with transverse maxillary deficiency. Well, we just snuck right in there, didn't we?
We did, right?
Yeah, so it's only about like 20 years old with the like mainstream clinical adoption in the last 10 to 15 years.
Yep. So interesting.
Yeah, I know, which is also like, I'm like, it still feels so new. I can't believe I'm doing this to myself. But no, it's going to be great. It's going to be great. And I think the body work thing. So like when I did my DNA Vivos appliance, which was removable and I only wore it like 8 hours a day, I was supposed to wear like 14 to 16. And I was like, I can't talk with an upper and lower appliance in my mouth. Like it was so bulky. So like, that's why I'm like, this will be interesting. But that literally, because it had the metal and the like plastic components of it, like gave very little space for my tongue. Like I could barely move my tongue with it in. So I'm like, this, I feel like I'll have at least a little bit more space, even though it'll be weird space. But they had, the dentist that I was seeing in Maryland had a PRI trained PT, actually two of them, like that came into the office one day a week each. And so they would work on the patient. So they would like schedule you for adjustments or check-in appointments on the days when like they were in. And then you would also have like an adjustment with them in office as part of the treatment plan, which was really cool. And then if you wanted to see them in between your appointments in office, you could go book, individually and pay for that separately, which is what I did. And so I worked with a PT who was PRI trained as well. And he used like manual counter strain technique. And he said it was like more of a modern counter strain technique, I guess, not the typical counter strain that people know. And it was very interesting because I feel like he worked on the lymphatic system. It was like reminded me a little bit of some craniosacral fascial technique, he would do the brain mapping. He would go, it was just amazing. And so I'm like, I feel like I need something like that again. I just don't know who that person is here in Boca. So like, get on it, Hallie. It's time to figure that out. We only have like a week and a half to go.
Well, I hope you do find someone, because I think that'll be just like helpful, because especially with the jaw, like, because that's what it, is going to be manipulating so much. And when you're talking so much, I feel like it'll be nice to just a little addition. But that's great that you did it before. So like you did so many things with Vivos.
Mm-hmm.
So yeah.
So I'm like, I know like my palate would kind of feel like it was locked up. Like I couldn't turn the key and put it in. It just physically wouldn't let me like put it in at certain points unless I had my body adjusted that day. And so it was really interesting to see like how much easier it was to continue expansion when my body was like unlocked. You know what I mean?
Yeah.
And I feel like it really helped a lot full body, but still my maxilla just like wouldn't give. I'm like, that needs to be like physically split apart from the other side. So here we are.
Oh my gosh. Yes.
Ready, set, go.
Yes. And then, so Myo related too, what are you doing to help yourself as you're going through it, Myo related? Like what types of exercises, what types of things are you going to be doing?
Honestly, I feel like I live Myo, right? So like, and I can do all the things, and my tongue is up when I'm not sleeping, and right. So I feel like with MARPE in, until it comes out of my palate, I'm not going to do anything with Myo because my tongue can't go up to my palate. So it feels very compensatory until that point. So I think I'm going to be more focused on making sure like I maintain my current skills, if anything, and then once like 8 to 10 months in, when the actual like MARPE comes out of my palate, the screws come out and everything, and I'm just in the clear aligners, I will probably like put myself through a round of Myo just to like make sure that with the new tongue space, with the new whatever we're seeing happen, that I am not compensating, because I'm guessing there are still some compensations in place that I may not even be picking up on right now, and until like the palatal shape changes a little bit more and I have a little bit more room. Like we were talking about it, and Dr. Koval was like, the palate does come down in most patients, right? So you actually have less like elevation that your tongue is trying to manage. It's not trying to overcompensate anymore to get higher up. And so sometimes it's actually easier to suction. And so it's like, well, you can even though things become like easier and you have like a different space, I feel like compensations can still happen, even though the space is more ideal. So I'm like, that's the one thing I'm a little keyed into, where I'm like, be curious to see like, does my tongue just automatically go up to the palate? Am I not getting a scallop tongue anymore? Like, am I, I don't know. I don't know. So Myo's on the table for like after the MARPE is.
Yes.
I keep saying installed and uninstalled like it's a software. Like once it's uninstalled from my mouth.
Oh yes. Well, so one thing that I am going to be doing though is some manual work on myself, like intraorally. So like floor of the mouth, some things with my jaw, like just some of the things like
more like myofascial release type of stuff, or
kind of. Yes. So, have you heard of Walt Fritz? He's a PT who teaches SLP.
Yeah, he spoke once in the membership, actually. Yeah.
That's awesome. He's so good. Maybe that's where I found him, actually, from the membership. I went to his like full training, but learned a bunch of techniques with like tongue pulling, tongue stretching and twisting. It's not true myofascial because it's not as like intense. It's more gentle maneuvers. But I'm planning to do some of that and hoping that that'll help with just as it's shifting to help with how that's sitting in my mouth and working. But you're
Yeah,
right.
I mean, like you talked about, like with the lymphatic system getting like locked up and everything, or, I feel like part of that is just when anything happens, the body kind of goes into this fight or flight. And it's like, what's happening? Why are we doing this? This is not our normal, like, MO. And so I feel like supporting the body through that, but also releasing any tension that you can anywhere and just kind of relaxing the surrounding muscles and the supporting muscles that are all going to be super interconnected in our orofacial structures, I think will be really, really important. And I know some myofascial like release techniques that I can do like in my mouth with my tongue and stuff like that, cheeks and everything. But yeah, I hadn't really thought about that too much, but I feel like for me, it'll be more like, ooh, I'm feeling this. Like, let me try this. You know what I mean? Cause
Yes, I mean, it's different when it's us because like we're practitioners, so like we have those tools at our disposal. But I'm also thinking for someone else who's maybe considering this as their journey and they're not like in this, like what else, how can they be supported? Because yes, myo, obviously a big goal is suctioning and getting it in your palate, but like there's so many more pieces to the muscles and how and when the right time is to do myo and when to do it all. And there's so much to it. But
I think that she recommends in her office, because she has a myotherapist in her office, an SLP myotherapist. And so, who's in there like maybe a couple of days a week. And so she definitely when you do your intake paperwork with her and you're like, you sign like an agreement and a contract and you're basically agreeing that you're going to do, myo and that you're going to do X, Y, and Z. And so she from the get-go is very, very big on like at least that support. And I think for most of her MARPE and appliance cases, it's when the appliance is coming out. And so like my kids, when they get their upper appliance out, they're still going to be in clear aligners for a while. So it's still going to hold that expansion. And that's why I think like she waits to go into myo until the palate is open, because you're holding the expansion. So you don't have the risk of relapse happening because you're going right into that clear aligner. So I think that's the biggest thing that my concern has always been is like, if we pause myo, if you're doing myo and you go into an expansion, like, do we stop? Do we continue? Do we restart once it's out? Do we risk like relapse happening because you're not going to move through myo fast enough to hold your expansion? You know what I mean? It's like all these questions. And so I do feel like she's like kind of thought through some of that. So it's like we maintain the results because we have something holding it while we reopen the palate, which I think is honestly genius. So
it is so genius. Yes. Like, I mean, I think that really makes sense. And that also proves like, I think we've talked about this too before, but how it's not just the appliance, it's also the practitioner. It's who is doing it. Cause it's really an art. Like orthodontics is really an art.
Yes.
You have to have the right person doing it. It can't just be everyone can do a MARPE.
Yeah. And she's modified like all of the appliances. So like when I'm like, well, people are asking me what appliance the kids got. I'm like, is it a Haas? Because I show people what it looks like and they're like, oh, that's a Haas. Right. And she's like, well, I mean, it might have like the bones or the idea of a Haas. She's like, but I've modified it in these different ways. Yeah. So it's not really a Haas anymore. It's like, you want to call it a modified Haas? Sure. But she's like, it's accomplishing different things and working differently than your traditional Haas expander. And I'm like, okay, that's the answer then. I don't know what else to tell people, like that's what we're doing. And then clear aligners. So
absolutely. No, that's going to be so great for your kids to have clear aligners versus.
Yeah. They have the lower one in already that started when they started their expansion. And so they're actually getting their upper appliance out in August. And so in a couple weeks, they're very excited and they'll go right into the clear aligners for the upper as well. So
that's amazing. That's really nice.
Yeah. And they're so good. They're like, Mama, it's Tuesday. We have to change our Invisalign. And I'm like, oh my gosh, you're right. And I didn't even realize what day it was. Thank goodness that you're on top of this.
That's amazing. My daughter too, I think she's close to your youngest age. She's almost 7 is my oldest. She just finished her expansion. And she's so good about it too. I'm just like, I'm so impressed by you. How you remember this? Like she remembers it. She remembers when to turn, we're done turning, but she remembered when to turn. She would like remind me, she's like, hey, it's Tuesday, it's Thursday. Yep. We got to turn. And like, it was so good. So
good. I know people don't give kids enough credit, like they they own it.
It'd be so amazing. And I think they get it more than we give them credit for too, like when they're in those appliances, and they're so fortunate too, because I feel like they don't feel the pain that adults feel. So giving
My
them.
kids definitely felt, I think, a little bit of pressure. Like they'd be like, "Oh, my nose!" Like I would turn the key or like whatever, and they'd be like, "Oh," like But then it was like momentary. You know what I mean? It was like 10 seconds later, it was gone. And I do feel like that they felt it a little bit when they were in their other RPE too, but they didn't really voice it the same. So I'm like, I don't know if it's because this one had like the plastic stuff, so it's actually physically pushing the soft tissue with the hard tissue. And whereas before in your traditional RPEs, like it's only like pushing the hard tissue, really. It's not like actually physically touching the soft tissue. So I think that changed like how they felt what was happening a bit more. But yeah, so that was interesting. So I was talking to her about it and I'm like, well, they mentioned like they could feel like that mid, like facial, shift. It was like momentary. I was like, is that what mine's going to feel like? And she's like, you're going to feel some pressure and then, but it'll be fine. Like it shouldn't be painful. I'm like, okay.
I'm so curious about that pressure feeling because I have heard that from people who have done MARPE, just that like they have this pressure, and I've heard a lot of pressure until the suture
splits. Yes.
So I'm curious, like, and this is where we'll have to like compare notes because I'm curious if I'll have that. I'm guessing I will. And you won't. So like maybe there's like another pro to
So because I was asking her about that, I was like, so my friend's having a lot of pressure right now because she's splitting her suture. And I'm like, am I not going to have that? And so her answer kind of sounded like I'm still going to have some pressure because I think it's not just about the palate splitting, but at the other surrounding, structures that are impacted by it too. So I do feel like maybe I won't have the same pressure in the same places, but I'll definitely have like that mid facial, like pressure that I think people kind of feel as things are moving. I was like, that makes sense. I mean, obviously it's going to impact other things too, maybe, but yeah, we'll totally have to compare notes.
Yes, no, we definitely will. Yeah, it's going to be interesting. And I love the idea of doing like some kind of journal, like each day or something, like a check-in, because it's definitely a big thing to go through when you're bored.
And I can't remember what the reasoning was, but somebody told me it's actually can be more painful for men than women. Oh, so we have that going for us.
Is that though because men just like have a lower tolerance for pain, or
maybe I don't remember, like it was something biological, physiological that is totally beyond my brain at the moment, but it was men I think feel maybe more pain surrounding it, and women feel and like the pain and the pressure, whereas women we may just have our body goes into that mode where it's like, you got this. We're not going to have you feel pain. We're just going to give you a little pressure. I don't know. I mean, we'll report back and let you know if that's true in a week or 2 weeks.
Right. I mean, I'm sure there's going to be something and there's going to be some complaining, but there's got to be something to that. Like just like biologically, like maybe we're just like made for more pain. Like we can just tolerate more. Or, I don't know, but that's too bad. I wonder what the percentage is for men versus women going into this and like choosing this as their like health journey,
Yeah, I have no idea. I feel like every time she's like MARPE day, like I'm like looking at it, and she doesn't always put the patient's like full face. It's like just their mouth, but you can tell if it's like a woman or a man, sometimes. And I'm like, there's been a couple men recently that have gotten it put in. So I'm like, okay, this is interesting. Right. I think that, I don't know. We'll have to see, but I think it may have been something hormonal too, with like the whole like pain tolerance and response.
Interesting. I wonder
another friend's husband who's an SLP is in MARPE now, and she said it was like really painful for him in the very beginning, and but she's not had like other women like report the same level of pain as her husband did, and I'm like, I don't know, maybe men are just wimps. So I'm sorry if there's any men listening, but you guys like sneeze and you're like, I'm dying. So there's that.
Do you know which one always cracks me up is there's a reel, and maybe this is more because I'm also a birth doula, and so I feel like it's maybe more in the birth space, but there's this reel that goes around that's like they've done studies that like the human body can only withstand X amount of pain, but during childbirth it's X amount of pain. And I'm like, did they do the initial study on men? Because clearly women can sustain more pain,
right?
That's what the standard is, like, and childbirth is like 10 times that amount or whatever. But I don't know, just my own theory, but it always cracks me up with that stuff because pain is such a hard thing to measure from person to person.
Very true. It is so subjective.
And I wonder how, like, even so on women though, like in health, even like because I know that there's some studies with this, like with sleep apnea, like more men are diagnosed with sleep apnea, but women still have the symptoms of sleep apnea, but we just don't have as many apneic events.
Yes.
But we're not getting that like quality deep sleep the same way. So I'm wondering, like, even like with hormonal shifts, like throughout the month, if that changes things too.
Maybe.
Or even as we're doing this, like, I wonder if like during different points in the cycle, if we'll have more pain. I don't know. Maybe
That's interesting. Yeah. I mean, I guess that would be interesting to track too, is like where you are in your cycle, like what your pain level is each day. Obviously, I feel like it's subjective, but I feel like through something like that on a day-to-day basis and matching it with your cycle month after month, like while this is in your mouth for at least 8 to 10 months, right? I feel like you probably can see some kind of a pattern based on like where your cycle is in the month. So that could be fascinating. Okay. Well, now, Jeannie, we need to just create an entire like cycle calendar and then a pain level. I mean, we have a lot of work to do in the next 10 days.
There's a lot of work. Is it only 10 days? Gosh, that's
11 days. I don't know. It's like we're recording this on July 31st. This won't go out for a couple of months. So people are going to hear this like after it's in our mouth. So now go follow us and check in on how we're doing, because this will go out, I don't know, I think middle of October maybe. And so by that point, yeah, we will be into the appliances. So you guys are getting like the front end discussion, and you'll be able to have a back end discussion too pretty quickly. But yeah, I think that'll be interesting, because there's definitely like cyclical like sensitivities and fatigue and hormonal changes that change your response to pain and all that. Totally.
Absolutely. Well, and then the aesthetics though, like I think by October we're both going to look different. Like I feel like there will be like, and we'll obviously notice them more than anybody else, but I feel like hopefully I'm praying that your nose stays the same, and I'm praying mine drastically changes. So
well, it's interesting because she said she's got a patient right now who did not want her nose to change because she's also had a nose surgery before, like a rhinoplasty, and she's getting married soon. So she was and the person's not even local. So like she was coming a lot more, I think, to like monitor, like, how she's doing. And so Dr. Koval was like, I will check in with you a lot to me. I mean, I'm 10 minutes away from her office, but she's like, we will monitor you more closely to make sure that like things are not like shifting away from where you want them to be. But I feel like I'd be more nervous if I needed like 10 millimeters of expansion. I'd be like, there's no way my nose is not going to change. Like, absolutely no way. I'm excited for you, because if you can avoid like a septoplasty or like, I don't know if your terminates are enlarged or any of that, like as you open your airway, I feel like if you can avoid that nasal surgery, like how freaking cool will that be?
That would be so cool. That's definitely the hope. Like, I really hope that it can help with like just nasal breathing is really like a big goal, is like just that nasal breathing would be easy and effortless, and that I just have more room in my mouth, in my nose.
Well, I'm excited. So here we go. All right. This has been amazing. I know we could talk like all day, every day, but we'll do a follow-up on this once we both have like relatively clear speech, and we can, come back and record on how things are going. You don't want to do it
with broken speech? That'd be really fun for everyone to hear.
Yeah. Hey, we can plan to do one in the middle of August. That'll be fun.
Oh gosh.
No one will understand what we're saying. It might be a little slushy, but it's fine.
Oh gosh. Maybe just a phone call so we can compare how awful we sound.
Totally. Yes. We will have to like phone call, FaceTime, that way we can see the facial cues when we're speaking. Maybe we'll understand each other better.
Yes. No, it's been so great though. Thanks for having me on. And I really hope that this reaches people who are maybe considering it, because it's going to be a good drastic change. So awesome.
Yeah. So where can everybody find you if they want to follow your journey?
Yeah, so I'm going to be documenting it all on Instagram. So my handle is the best Myo. It's not because I think I'm the best. I mean, there's some of that, but it stands for Breathe, Eat, Sleep, Talk. So my website is that as well. So thebestmyo.com. But also Breathe, Eat, Sleep, Talk is my business name. So that's where to find me.
Yeah. Thank you so much for joining me.
Quick disclaimer. All information, content, and material of this podcast are the opinions of the speakers and is for the informational purpose only and not intended to serve as a substitute for the consultation, diagnosis, and/or medical treatment of a qualified healthcare provider.
Thanks for listening to this podcast. If you found value in this episode and want to hear more of these Myotots, airway, and feeding related episodes, be sure to leave a review on Apple Podcasts and share this episode on your social media platforms. You can access free resources and all I offer at HallieBulkin.com or pop over to @HallieBulkin on Instagram to get all the latest updates.